Hi, I'm Bailey.
I'm Erin, and we're doing our Healthy People presentation on LGBTQ health.
According to Healthy People 2020, lesbian, gay, bisexual, and transgender encompasses individuals from all races, ethnicities, religions, and social classes. Their goal is to improve the health, safety, and well-being of LGBTQ individuals.
Hopefully by the end of our video, we will learn how important mental health is as a part of LGBT care and have a better idea of what we as nurses can do to make their healthcare experience more comfortable.
Due to social stigma, LGBTQ individuals face discrimination in all areas of life, including housing, employment, health insurance, and health care. These inequalities have been linked to high rates of psychiatric disorders, substance abuse, suicide, violence and victimization, and all of these have lasting effects. As Healthy People 2020 states, personal, family, and social acceptance of sexual orientation and gender identity affects the mental health and personal safety of LGBTQ individuals.
Here are some facts that will help to understand the importance of comprehensive LGBTQ healthcare. LGBT youth are 2 to 3 times more likely to attempt suicide. LGBT youth are also more likely to be homeless. Lesbians are less likely to get preventative services for cancer. Gay men are at a higher risk of HIV and other STDs, especially among communities of color. Lesbians and bisexual females are more likely to be overweight or obese. Transgender individuals have a high prevalence of HIV, STDs, victimization, mental health issues, and suicide, and are less likely to have health insurance than heterosexual or LGB individuals. Elderly LGBT individuals face additional barriers to health because of isolation and a lack of social services and culturally competent providers. LGBT populations have the highest rates of tobacco, alcohol, and other drug use.
We can all do better to understand and address environmental factors that contribute to these health disparities in the LGBTQ community. As RNs, our job is to advocate for our patients, protect their human dignity, support their mental and emotional health, educate the patient and their family, and ensure clear communication is made to all other members of the healthcare team.
So now we will show you an example of how not to treat your patients. Notice the behavior of the nurse when interacting with her patient.
Hello.
Hi, I'm Erin. I'm going to be your nurse today.
Okay.
Can you please tell me your name and date of birth?
Well, in your papers it might say that my name is Bailey, but I prefer to go by Joe. My birthday is May 11th, 1992.
Okay, Bailey, and when was the last time you've been into the doctor?
I don't really like to come into the doctor, so I probably haven't come in a few years.
Well, you really should come in at least every year for an annual checkup.
Okay.
So can you tell me what brings you in today, Bailey?
I haven't been feeling very well. For example, I haven't been sleeping and I haven't felt like eating anything. And it's really hard to concentrate and focus. I just can't even think straight. I don't feel like doing the things that I normally like to do, like being with my friends or playing soccer. I just haven't felt like myself lately and I can't seem to snap out of it.
So can you tell me what year you are in school, Bailey?
I'm a sophomore in college.
Okay, we see this a lot with college students making that adjustment. I'll bring the doctor and we might look at putting you on some antidepressants. Okay, thank you, Bailey.
Okay. In this example, I was a transgender youth. Erin was my nurse, and from the very beginning, she disregarded the name that I preferred to be called, and just called me by my legal name stated on my intake form. She didn't let me explain why I liked to be called Joe, and failed to inquire more about my request.
Then, when Joe tried to explain why he hasn't been into the doctor, I cut him off. Instead, I could have asked him about why he doesn't like to come to the doctor, and I should have listened to his complete answer.
My nurse also didn't look at me or make any eye contact. Instead, she was looking down at her notes and charting the whole time. She also made assumptions about what was triggering my symptoms of depression. Instead, the nurse should have inquired more about Joe's life. For example, she could have asked about Joe's recent transition as a transgender person. She might have asked if his friends, family, and school community were supportive of this huge change.
As the nurse, I just jumped to conclusions and medications instead of support groups and other interventions, and I didn't utilize any of the tools we have as nurses, like the PHQ-9, when I started suspecting depression. I also did not treat my patient with respect as I was staring at my chart the whole time and didn't bother to call Joe by his right name.
Now we will show you an example of a better nurse and patient interaction. Hello.
Hi, my name's Erin. I'm going to be your nurse today.
Nice to meet you.
Can you tell me your name and date of birth?
My name is Joe. I was born on May 11th, 1992, but in your charts it might say that my name is Bailey.
Okay, I'll just make a quick note of that. Joe, is there anything else in the chart that needs to be updated?
Yes. In the last 3 months, I've recently transitioned to have a different gender identity, and I now identify as a male.
All right, I can make a note of that too.
Okay.
Joe, when was the last time you were in to see us?
I don't come into the doctor. It's been a few years because I get worried that they might not call me the right name or refer to me as the right gender.
Well, I'm so sorry you had to experience that. Hopefully with these changes in your chart, and I'll go talk to your doctor and we'll make sure everyone's on board so that you can come see us when you need to.
Sounds good.
Okay, so then what brings you in today, Joe?
I haven't been feeling like myself. I haven't been sleeping at all. I haven't been eating. I haven't been able to focus or think clearly. And I also haven't been doing the things that I normally like to do, like be with my friends.
So when would you say this all started?
It probably started about 3 months ago when I started to transition to being a male. My family hasn't been very supportive, and my friends haven't been very supportive either, so I think that that's triggered some of it.
Okay, we'll start with this. This is a brochure I have on some support groups and numbers for some transgender youth. And Bailey, it sounds like you might be experiencing some symptoms of depression.
Okay.
So I have a little questionnaire called the PHQ-9. It's going to get more into the specifics. Are you comfortable going through those questions with me?
Yeah, that sounds good.
Okay, so I'll go grab the form and then I'll bring in your doctor and we'll see if we can help you out today.
Sounds good.
All right, thank you, Joe.
Thank you.
In this example, I as the nurse was more receptive to Joe, and I made the changes to his chart that were needed. I was more attentive to my patient and didn't stare at my notes the whole time, but instead I faced my patient and I made eye contact. I also didn't cut Joe off in his answers, and I let him explain everything clearly and further inquired about Joe's symptoms to try and make connections. I was also ready with helpful resources when Joe expressed lack of support in his life, and I didn't jump to conclusions. I fully utilized tools found in many hospitals and healthcare provider offices, such as the brochures and the PHQ-9.
The nurse allowed me to talk more about my feelings and experiences. She was respectful of my decision to transition into a new gender identity. She apologized for previous visits to the doctor that had been unpleasant and reassured me that the healthcare team would now refer to me as I wished. Erin also called me Joe throughout the video, just like I asked her to. She also gave me a brochure about support groups. We hope this video helped illustrate our job as nurses in the care of the LGBTQ community. Our goal was to explain and demonstrate what problems can arise when healthcare professionals are not properly equipped. We hope you understand the importance of caring for the mental health of this community, as well as factors that put them at risk.
Thanks for watching, and remember, as nurses, we are allies to the LGBTQ community. Don't be afraid to ask questions and expand your skills and knowledge in order to better serve your patients.